The next study I felt of merit was looking at ginger. This was a clinical trial in roughly 50 patients who had gastrointestinal symptoms and also had multiple sclerosis. So we have to be a little bit careful because this is a specific population. But nevertheless, let's look at what they found. Comparing placebo to a 500 milligram ginger capsule that was taken 3 times per day, they found that ginger improved constipation and bloating. The researchers commented as follows, quote, "Ginger supplementation for 12 weeks significantly reduced the frequency and severity of constipation as well as the severity of bloating." So like I was saying a moment ago, the nice thing about these natural agents is they have multifold actions. In this case, ginger improves constipation and improves bloating, and the probiotics improve regularity or motility and may also improve things like pain and discomfort. Regarding ginger, it's anti-inflammatory, but it also contains these compounds known as gingerols, not ginger ale, but gingerols. And these gingerols have been documented to increase serotonin in the gut. And this is one of the mechanisms through which ginger will improve motility. Ginger is also used in pregnant women for nausea. So a lot of benefits associated with ginger. And you can take ginger as a tea, or there are 2 products that I'll share here wherein usually you'll need 1 or 2 capsules of ginger to hit that 500 milligram, and you can take 1 to 3 times per day. Remember, these studies used 500 milligrams 3 times per day. I wouldn't get overly into, or this one study, because it was a 1 randomized control trial, I wouldn't get overly into the weeds in terms of do you have to be uber specific in your dose. If you can take the 500 milligrams 3 times per day, great. If you can have a cup of ginger tea 1, 2, or 3 times per day, great. And this will move you in the direction of healing your gut, reducing symptoms, and improving regularity. And the final point here I wanted to make was regarding pelvic floor therapy for otherwise non-responsive constipation. So think about your care plan following the flow of the studies that we've outlined. Lifestyle and supplemental interventions first. And then this would be if you've done all of those other things and you're still not seeing the regularity that you'd like to have. So in this clinical trial, 40 patients with constipation and who had pelvic floor dysfunction and were also unresponsive to laxatives and lifestyle modifications underwent pelvic floor biofeedback, and they experienced a 50% reduction in the severity of their constipation. What is pelvic floor biofeedback? I always reference Satish Rao, who is a gastroenterologist at U Augusta, who was on the podcast a number of years ago. His analogy was a tube of toothpaste. We want to take the cap off and squeeze the contents, therefore expelling the toothpaste. And in pelvic floor maltiming, if you will, or malcoordination of the muscular contractions, what can end up happening is your anal sphincter stays closed, the cap stays on, and you don't contract to expel the stool. And what the biofeedback therapy does is help people re-engage or correctly engage the musculature, where you contract the abdomen, to create pressure to expel the toothpaste or the stool, and you relax the anal sphincter to allow stool out. Populations that may be at highest risk for pelvic floor dysfunction would be postpartum women and people who have had surgical trauma, like hysterectomies, as one example, but not an exhaustive list. And also people who are training really hard and they're doing a lot of bearing down. All of these things, and also, those who are aging as a natural byproduct of aging, sort of weakness in the pelvic floor musculature. And the pelvic floor is essentially between either the penis, vagina, and the anus, right? It's that literally the floor of your body. And we've had some nice conversations with Jandra Mueller, who is a pelvic floor therapist. I'll put some resources for her and her clinic here, and also another directory if you wanted to look into that. So when we summarize everything that we've discussed, we have some great options for improving regularity. walking. Remember, if you move, your stool moves. Abdominal massage, probiotics, ginger, and pelvic floor PT. So a lot of tools that you can use to improve your bowels.